Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Colchicine. Colchicine is actually the oldest anti-gout medication. This colchicine is the most toxic drug and it is a plant-derived alkaloid, that is colchicine. It is an anti-chemotactic agent. It will prevent the microtubule formation and it causes metaphase arrest. This colchicine also causes metaphase arrest and it will also prevent the migration of leukocyte or lymphocytes. That is nothing but it prevents chemotaxis. The most common side effect is diarrhea. The other side effects of colchicine are it can cause neuropathy or it can cause myopathy or it can cause alopecia or it can cause bone marrow depression. Whereas pharmacokinetics of the colchicine are the colchicine can be well absorbed and it is eliminated by the bile. It can be used for recurrent or refractory gout, and also it is also used for acute Mediterranean fever.
thank you and thank you for watching.